Hello, everyone. My name is Erika Gonzvar, and I'm a second year Master of Public Health student at the University of Arizona at the Enid Zuckerman College of Public Health. This year, I was selected as a 2024 Global Health Institute Scholar. So I'll be sharing a little bit about my experience in Mexico City at UNAM FES Zaragoza. So, a little bit about me. I'm born and raised in Tucson, Arizona. I have a Bachelor of Science degree in Healthcare Administration from Grand Canyon University in Phoenix. Some of my main interests within public health are border and migrant health, child and maternal health, and public health promotion. And I really enjoy traveling, photography, and of course, trying new foods. So this is my first day at the FES Zaragoza campus. They have three campuses that are dedicated to FES UNAM, which are more of their medical campuses, and I spent the majority of my time at Campus One. So, to introduce the projects that I worked on during the 5 weeks I was here, first, I did an emancipatory health workshop with the elderly population in East Mexico City, as well as a health fair that concentrated on it was against tobacco consumption, as well as a project that was based on appropriation and capabilities with working women in the city of Nezahualcóyotl. So first, the health emancipation workshop with the elderly. It was a workshop with elderly adults that lived near campus too. So we helped them with brain and memory exercises, um, and also helped them realize the human capabilities they have and the emancipatory part of their health that will help them decide and have freedom to make their health related decisions. And we also covered the six human capabilities to help them think about how they can make those health-related decisions. After that workshop, it was very successful. We got a lot of participation from the elderly adults during that first workshop. They left very curious and saying that they want to continue doing those exercises to better their memory and maintain their overall health and well-being. So they left very motivated and wanting to continue having those workshops. Next was the health fair against tobacco use. There's a picture with Professor Alberto Naum, which I worked closely with during my 5 week stay, as well as Daniela Cervantes, which was a medical surgery student um, studying at UNAM. So my presentation for the health fair, um, they gave me about a week and a half to prepare my presentation as well as prepare an interactive activity during the health fair. So I decided to focus and base my presentation on the social determinants of health that influence tobacco use. And as far as my interactive activity, I used a roulette wheel to ask questions and then provide prizes for the activity. And the social determinants of health that I focused on presenting to the students was that it usually first starts with social pressure at a school setting, as well as stress, access to medical care, and socioeconomic status. And the social determinants of health that I presented were focused on Mexico City. Next project was the appropriation and capabilities with working women in the city of Nezahualcóyotl. It's on the east side of Mexico City. And so we went into the markets, the food markets near in that city, and we asked women if we could interview them, just to hear a bit about their life stories and how they started working in the markets and what they do to maintain their overall well-being. The objective was to then create a manuscript for them to reflect on and allow them to share their own stories with others. And we did get some no's, but we did get two yeses, so that was great. We did have the privilege of interviewing two women from Mercado Las Maravillas. We interviewed Maria Paz and Ruby Aviles, who allowed us to interview them, and we assured them that the manuscript that we were going to be working on was not going to be published. It was simply for them to use and to share if they would like to. So that's a picture of me and Maria Paz on my last day when I said goodbye to her and I delivered the manuscript that we worked on. She was a lovely lady. We asked her for a quick 5 to 10 minute interview, but it did last about 2 hours. So we appreciate her so much for allowing us to listen to her life story and what she's gone through her life and for trusting us to create the manuscript for her. And that's a picture of me and Daniela Cervantes, which is again the medical surgery student. And we worked together on this project, and she focused on interviewing the other woman, Ruby Aviles. And so that concludes the projects. I did also want to share a couple of pictures from the exploring I did around the city. It is an absolute beautiful city, and I absolutely fell in love with it. The exploring I did, I was able to visit Monumento a la Revolución. It had a great 360 view of the city from that viewpoint. I also had the opportunity to go on a hot air balloon ride over the Teotihuacan pyramids. So that's definitely something I got to check off my bucket list and definitely worth waking up at 3 a.m. for. I also visited the Palacio de Bellas Artes. They have a lot of multicultural and cultural events there. And I did get to see one during my first week there. And it was a lot of folklore dances from the different states in Mexico. And then a little more exploring, that's the view from Monumento a la Revolución, as well as Xochimilco. I did that on my last weekend there. I really took advantage of it. It's known as like the Venice of Mexico. A lot of live music playing on the boats, a lot of delicious food, and just great vibes overall. And then that's a picture of me at Museo Somaya. It's a modern and contemporary art museum with a lot of different structures. It was really beautiful. And then that was a view from the hot air balloon. I also visited the Basílica de la Virgen de Guadalupe. And then that picture was during my first weekend in Mexico City at the Chapultepec Castle. I also, of course, have to share the delicious food and the gastronomy from the city. These were some of my favorite plates that I tried during my time there. That first one is a picture of a Cantonese-inspired taco. It was from a restaurant that was rated by Michelin, so it was a Michelin recommended restaurant. And then the middle one was one of my absolute favorites. I did end up eating at this place about 3 times. It's called torta de chilaquil. It's basically a fresh stuffed bread with breaded chicken and then tortilla mixed with salsa, and it's absolutely delicious. And then of course I had to try the tacos al pastor. Those are a staple in Mexico City, so I couldn't let that pass by. And then here is the picture of the students I got to work with during my 5 weeks there. Like I said, I got to work with a lot of nursing, medical, and nutrition students, and they each do their rotations at the on-campus clinic here. And most of the projects that they focus on are focused on public health promotion for the students on the UNAM campuses. So thank you very much. I am super thankful for this opportunity for from the Global Health Institute. I really appreciate having gotten the chance to practice my global health and public health practices in Mexico City. So thank you so much for this opportunity.